And more now on the troubled rollout of the Affordable Care Act's online marketplace, Healthcare.gov. A company called CompuWare took an independent look at what users of the website experience as they shop for health insurance plans. And what they found may surprise you. Bertha Coombs has more.
How bad was the first day of open enrollment on Healthcare.gov? Just 6 people managed to enroll in the first 24 hours, according to newly released health department documents. By the morning of October 3rd, fewer than 250 because of the technology problems plaguing the site. While access was universally poor, the site's glitches appear to have made access in some of the 36 states on the Federal Insurance Exchange worse than in others.
There are variations that tend to be affected by geography or which internet service provider you're using or even which browser that you're using.
Engineers at CompuWare in Lexington, Massachusetts began independently tracking Healthcare.gov end user experience in mid-October. At that time, users in a handful of states like Oklahoma in green saw pages load with normal 1 to 2 second performance. But for most in red, it was taking well over 8 seconds.
Those tend to be factors that relate to geography because different service providers exist in different geographies. There are certain techniques that can be employed to minimize these kinds of differences.
Recent fixes appeared to have improved user experience times overall.
We want to provide a performance testing environment or at scale, so millions of users are simulated users are running against your site to make sure that it will scale and provide the response times necessary under that condition.
Jeff Zients, the Obama advisor overseeing the tech surge to fix Healthcare.gov, says their measurements are now showing that page loads are taking less than 1 second on average across the site. But here at CompuWare's end user testing, they are still seeing wide disparities. In Kansas City, Kansas today, it was pretty good, about 4 seconds. But still, next door in Kansas City, Missouri, it was taking over 30 seconds.
To improve your own experience, CompuServe suggests making sure you have the latest version of your web browser, clearing your cache history of old Healthcare.gov cookies, and optimizing your connection by making sure you're not slowed down by sharing Wi-Fi, for example. Health officials vow the site will work smoothly by the end of this month.
Well, they'll see a surge of activity that they better plan for.
Because the stakes are far too high now for another failure. Bertha Coombs, Nightly Business Report, Lexington, Massachusetts.